Achalasia, a disorder of the esophagus and its treatment. Achalasia is a disorder of the esophagus that makes it difficult for food to pass down into the stomach. This happens because of two main factors. Causes of achalasia. The exact cause of achalasia is still unknown. However, several studies suggest that it may be related to neuromuscular dysfunction. The nerves that control the esophagus contractions may be impaired. Lay weakness. The smooth muscles of the les may degenerate or become dysfunctional. Causes of achalasia. Genetic factors. Evidence suggests that achalasia can run in families. Symptoms of achalasia: dysphagia, difficulty swallowing solid food, followed by difficulty swallowing liquids. Chest pain, a burning or aching sensation in the chest, especially after eating. Regurgitation, spitting up undigested food, sometimes mixed with stomach acid. Symptoms of achalasia: weight loss, difficulty swallowing and regurgitation can make it hard to eat, leading to weight loss. Dry cough, food backing up in the esophagus can trigger a cough reflex. Belching, frequent belching, sometimes with the smell of food. Diagnosis of achalasia: esophageal endoscopy allows a direct view of the lining of the esophagus and assesses the ability of the les to relax. Esophageal manometry measures the electrical activity of the muscles of the esophagus to evaluate their ability to contract. Diagnosis of achalasia: barium swallow uses a contrast agent to visualize the esophagus and its ability to empty food. Treatment options for achalasia: the goal of achalasia treatment is to reduce lay pressure, improve the passage of food into the stomach, and alleviate uncomfortable symptoms. Treatment options include muscle relaxants. These medications help to relax the les, making it easier for food to pass through. Anticholinergic medications: these medications reduce the activity of the autonomic nervous system, helping to relax the esophageal muscles. Treatment options include botulinum toxin Botox injection. This involves injecting Botox into the les, temporarily paralyzing the muscle and widening the passage for food. This option is often used for patients who are at high risk for surgery or who haven't responded to other treatments. Treatment options include endoscopic lay dilation. This uses a specialized tool to widen the les. Helor myotomy. This surgery involves surgically cutting a portion of the les, allowing food to pass through more easily. This option is often considered a last resort when other treatments have failed. Important considerations: the choice of treatment depends on the severity of the condition, the patient's overall health, potential risks of complications, and the patient's preferences. Achalasia requires regular medical monitoring and follow-up to assess treatment effectiveness and address potential complications. Complications of achalasia: esophagitis, food backing up can irritate and inflame the lining of the esophagus. Esophageal stricture, chronic food buildup and inflammation can lead to a narrowing of the esophagus. Esophageal cancer: while rare, patients with achalasia have an increased risk of esophageal cancer. Complications of achalasia: esophageal perforation. The pressure from trapped food can cause a tear in the esophagus, a life-threatening complication. Recommendations: consult a gastroenterologist for a diagnosis and a personalized treatment plan. Adhere to your doctor's treatment recommendations for optimal results. Maintain a healthy diet, avoiding foods that are difficult to digest, spicy foods, and very hot or cold foods. Recommendations: regularly exercise and maintain a healthy lifestyle to boost your overall health and prevent complications. Disclaimer: this article is for informational purposes only and should not be considered medical advice. Always consult a healthcare professional for diagnosis and treatment of any health condition.